Today is World Tuberculosis Day. It's a preventable and curable disease, yet TB incidents and deaths are on the rise for the first time since 2005. TB is the world's biggest infectious disease killer, hitting low-income communities the hardest. Last year, AHS recorded about 250 active cases of TB in Alberta. Victoria Kassar is a volunteer with Results Canada, working to raise awareness of tuberculosis. Thanks so much for joining us.
Hi, thank you for having me.
Well, we should start with what TB is and how it spreads. Can you explain that?
Sure. So tuberculosis was the deadliest infectious disease before the COVID-19 pandemic. It is a preventable and curable infectious disease that's affected more than 10.6 million people worldwide in 2021, 1.6 million of whom died from the disease.
Okay. And how is it spread?
So tuberculosis is spread through many different avenues, mainly through social determinants of health like housing, overcrowding, poor access to healthcare.
Right, and it spreads through droplets in the air. Is that correct? Like coughing, that sort of thing?
Yes, that is.
Okay, gotcha. And so the World Health Organization designated TB as a global public health emergency. Well, that was back in 1993, yet it's still killing a lot of people. There's a rise in cases. Can you tell us why that is, and has the pandemic played a role in that?
Yes, so the COVID-19 pandemic reversed years of global progress on tuberculosis. Now we are witnessing an increase in the incidence and total deaths due to TB for the first time since 2005. And this is mainly because resources such as staff, funding, and physical infrastructure were diverted to support global COVID-19 efforts, which caused disruptions and delays in TB diagnostics, case notifications, treatment, as well as a decline in the quality of TB care.
Right. Oh, that's sad. Well, so in Canada, I understand that case rates among Indigenous people are 300 times higher than in non-Indigenous populations. Why is that? You mentioned, housing or access to health care.
Well, some refer to tuberculosis as a disease of injustice, and I think that's very accurate in this case, increase in rates that you had just mentioned. And there are many factors that increase the risk of tuberculosis, including a lack of political will to address the issue, which disproportionately impact many Indigenous communities.
Mm-hmm. Victoria, what is Results Canada advocating for? What would you like to see?
Well, Canada's actions take two fronts, domestic and global. In both cases, we need a combined, renewed political will and to invest financially. In Canada, we're advocating for a nationally coordinated tuberculosis elimination strategy that plans on increasing investments in grassroots organizations doing the groundwork to support people with TB. And globally, high-income countries like Canada have a moral imperative to address tuberculosis. Canada needs to increase its support for TB elimination mechanisms that target prevention, improve diagnostics, and treatment. Specifically, Canada, we're hoping, will engage in the upcoming United Nations high-level meeting on TB set for September, where TB advocates like myself hope that Canada will step up and commit to concrete actions to help eliminate tuberculosis at home and abroad.
All right. Well, good luck to you and Results Canada. Thanks so much for joining us.
Thank you for having me.